We need to get hospital-based care teams to help long-term care staff manage these outbreaks. And I want to see specialized teams deployed into long-term care homes when there's a serious outbreak. This is something that our officials are working on right now. And tonight, we'll issue a new emergency order that will ensure every employee in these long-term care homes can only work in one home.
Hi, I'm Vashi Kapelos, and this is Power and Politics on CBC News Network. We're streaming live around the world on CBC News app and cbcnews.ca. I'd like to welcome viewers joining us on CBC television in the Maritime provinces. Good to have you with us, as always. Ontario, as you heard there, is redeploying some of its health resources as COVID-19 continues to move through long-term care facilities. Right now, 114 of the province's 626 long-term care homes have outbreaks. Nationally, nearly half of all deaths have been linked to these types of facilities. Premier Ford says his government is only able to do this now because the province has not seen the surge in hospitalizations it was anticipating. So what does that tell us about the state of Canada's fight against COVID-19? Dr. Gerald Evans is the chair of the Division of Infectious Diseases at Queen's University's School of Medicine. He joins us from Kingston, I believe, right? Am I correct?
That's correct.
Okay. Hi, Dr. Evans. Good to see you again.
Good afternoon, Vashi. Nice to be back.
I appreciate you making time for us. Can I start on long-term care homes? Because I think Dr. Tam yesterday sort of laying out for us that nearly half of all the deaths have occurred there. And then what we've seen in so many provinces of sort of premiers directing their attention to the situation there has really stuck out to me. What can you tell us about, I guess, the fight moving to these long-term care homes?
Right. I mean, clearly they're a focus, and we've known since the arrival here in North America with the outbreaks in Washington State that long-term care facilities were a particular Achilles heel in the system. Here in my locale in southeastern Ontario, we've already started the development of what we're calling SWAT teams who can go out and help long-term care facilities and even retirement homes when there are problems or when outbreaks occur. And so I think this is a reasonable thing to do. And again, given the fact that we've been quite successful, certainly in my region of Ontario, but I would say generally in the province of Ontario, with flattening the curve to the point where the capacity of the healthcare system is allowing us to now go out and really get into these areas where I think we can have the most significant impact on reducing deaths from COVID-19.
Can I ask you, Dr. Evans, to expand on that? Because I think it's important to get the context from you. We are sort of inundated with all sorts of numbers, be it number of cases, number of recoveries, as well as number of hospitalizations. Based on the trajectory that was anticipated, how would you evaluate the situation? Let's be specific about Ontario, for example, that's happening right now.
Right. So we've really flattened out that curve. I mean, that big surge which people have been hearing about that occurred in Italy and in Spain and in New York City really has been reduced here in the province of Ontario through measures that have been acted through the public health interventions on social distancing. They were started while we were early in the arrival of the pandemic here in Canada. And so they've had a fairly significant impact on reducing that very large peak in a short period of time, which we felt was going to overwhelm the system. And here in Ontario, what we're seeing is there has been a rise, there has been a surge, but that surge has remained within our capacity at the moment for the healthcare system to handle.
So what should that tell us for people who listen to that and say and think, okay, well, do we have to keep doing this? Because it's you know, if we aren't faced with the critical situation we thought we might be, can we ease off on this stuff? What would you respond?
Well, I think the problem is that this has been effective, but it doesn't mean that you take your foot off the gas pedal, if you want to put it that way. It's only by maintaining and continuing our social distancing measures and our public health measures that we're going to ensure that that curve stays flattened. If we back off too early or too dramatically off of that, what we will see is what all of the modelers have shown us, and we certainly know, and I know from my work in pandemic influenza planning, that we'll see a second wave, and that second wave in many ways can be just as bad as the first wave. So any sort of attempts to pull back on the public health measures that are in place that have been, I would say, successful to this point, certainly here in my province of Ontario and in many other provinces across Canada, particularly BC, is that we need to maintain these, and we're going to need to maintain them for a period of weeks, if not months. Any sort of pullback has to be done in a gradual fashion. It has to be staged, and we have to see the effect of pulling those back to watch out for second waves of COVID-19 emerging out afterwards. So it's going to have to be a very careful, measured response as we pull back. But right now is not the time to pull back. Right now is the time to maintain it and then begin our plans to move forward with a reduction in those public health measures in an attempt to get society back to some degree of normalcy.
If I could circle back to the long-term care homes, Dr. Evans, we're waiting for Alberta's update as well as BC's update. You touched on BC. One of the things they did very early on was restrict workers from working in more than one of those homes. We saw today that the same rule will come into effect in Ontario. What kinds of policies should be brought into effect across the country, really? Like, what works when it comes to long-term care homes and preventing the further spread, I should say, of the virus?
Well, one of the things is a real clampdown on restriction on visitors. The disease is brought into long-term care facilities from visitors and to some extent staff who are infected out in the community. And so an intensive screening process, restriction on visitation, screening extensively for staff before there's an infection, and the placement of these measures into long-term care before you get out and you've already seen it enter into those facilities. One of the things that I was certainly involved in with pandemic planning and influenza was the recognition that many long-term care facilities share staff. And that sharing of staff can actually be a bit of a problem because those staff may work in 1 or 2 or 3 long-term care facilities, particularly in rural regions, and that can facilitate the transmission of the infection to those types of facilities. So, again, these are policies that would be important to bring in order to reduce it emerging into what are very vulnerable sectors.
Yeah, do you think that a lot of what we've seen over the past, it's a few weeks, but it's really been scrutinized heavily over the past few days with long-term care homes, is exposing sort of a system that many who have family involved in are aware of, but many who don't aren't? And I'm wondering what you think of that system and maybe what lessons we might get from all of this.
Yeah, I think there's a lot of lessons to be learned in here. Infection prevention and control in the hospital environment, where I work in an acute care tertiary hospital, is very well established. It's resourced appropriately. There's good infrastructure to make it run. But once you get out into long-term care and once you get out to retirement homes, which are, again, a conglomeration of usually older individuals, but who are not particularly sick, the sort of infection prevention and control measures that we have and accounted for in the hospital start to wane off, and their ability to ramp that up and do things to prevent infection transmission within those institutions is really, really challenged. And I think there needs to be a move to either providing that infrastructural support or even re-looking at the whole way that nursing homes and retirement homes are run. Essentially right now they're private businesses, and as such there are lots of other sort of conflicts of interest that can come into play, and they're really not structured to handle a pandemic. And I think we're going to learn a lot after this happens as to what should be changing in long-term care.
Dr. Evans, before I let you go, we're just about to head to Alberta to get the update from that province. The premier of that province on this show last night talked about Health Canada. He said that they're playing catch up, and he talked about the possibility of using tests that are approved by regulators in other countries, but not yet by Health Canada. Just wondering, we've had lots of political reaction to it, but apolitically speaking, what is your reaction to that?
Well, first of all, I think Health Canada has actually done a very good job, or at least the Public Health Agency of Canada has done a very good job with this. As it comes to regulating tests, that is challenging, and I think you cannot just roll out tests that have been developed in other jurisdictions because they may not be valid. The best example is the Americans. Their first test was terrible. To be fairly short about it, it wasn't a good test, and it had to be refined. And if you were rolling out a test like that right now, you would really not get any results that you could act on and work with reliably.
Okay, I'll leave it there. Thanks so much for your time, as always, Dr. Evans. Really appreciate it.
Thanks for having me on your show.
Hi, I'm Vashi Capellos, host of Power in Politics. See more of our show by subscribing to the CBC News channel or click the link for another video.